Until now, we were, as parents, of course, very, very anxious, but the anxiety was restricted to keeping our kids busy and taking care of ourselves because we thought that our kids were safe. Now the tables have turned, and we know that our kids are at a far higher risk, or probably as much of a risk as us, and therefore it becomes an even more anxious moment for us as parents. And that's exactly what we're going to discuss with Dr. Nihar Parekh today, who's been very generous and taken out time of his busy schedule to be with us today and share all the anxieties of all of us as parents and chat with us today about COVID and kids, about breastfeeding moms and what should their protocol be, and of course, more importantly, how do we really take care of what's ahead of us, and of course address all the anxieties and questions that we as parents have. Hello, Dr. Parekh.
Hi, how are you?
You seem to be extremely in demand, and your video seems to have crossed like a lot of views. What made you really get out there and say, I need to talk about this?
Started all like a month ago when we kind of realized that we're seeing a lot of kids with fever, but all their patterns were very similar. All the patterns were very similar in the form of having fever for 2 to 3 days, were very similar on clinical examination of speculated small blood spots on the throat, non-specific symptoms of vomiting and non-specific symptoms of stomachache and cramps and rashes. And because of the panic, a lot of parents said, doc, we'll just test. And some we recommended because we wanted to make sure that it wasn't COVID and we wanted to make sure we understand the pattern of what's going on. So last month, in the first 5 days, we were averaging 10, 20, 25 kids a day turning positive. Right. So I'm like, look, what the hell is happening here? There's some problem. We need to figure out what the cause is, and we need to study this disease because till now, the disease hadn't been studied in kids. Till now, we didn't know for sure what's going to happen because it was the first time the kids were actually getting infected and turning tested. The whole myth and pride of kids only being carriers was actually kind of turning tables, and now the kids were at the receiving end of this particular disease. So the goal was to find out, and then every day complaints, high-grade fever, and to the extent that in 15 days we asked the parents not to test because we realized that the kids we diagnosed 15 days ago were hale and hearty in 5 to 7 days. So the whole concept of testing, isolating, and treating was the same. But because of the isolating factor being very different in kids, we started thinking, look, there is a lot of panic. We need to set out some set protocols that we need to tell the parents to reduce the panic. The goal has always been to reduce the panic. Now, I want to take this opportunity here, to get on a very important statement. I kind of made that video, and I'm very glad that a lot of people saw it. I'm very glad that a lot of people kind of understood it, and it reduced the panic because we got feedback that we are happy now. We know what to expect and what not to expect. From that on, I've been trying to talk to as many platforms as I can. The goal of talking to so many parents, and through your lovely platform, the reach is so high. I've never been an Instagrammer till I put this video. I put one odd picture with my wife like a year ago, and then one COVID video when it started. But then I said, let me take this opportunity, try it out. And then I saw the power of social media, especially platforms like yours, which the reach is so phenomenal that then on I decided I'm going to go and kind of hopefully be able to speak to so many mothers in the next 10 days, only to request one thing. Yes, to reduce the panic, obviously. Second is to understand that this next 7 to 10 days or 14 days, and you know what? It got reiterated last night when Uddhav Thackeray spoke, that we are going to have a sort of lockdown for the next 14 days. Now, I want to convey that same thing, that he's not spoken about children. Nobody speaks about children. Nobody speaks about what's to do, what's not to do. There are no hospital beds for adults. What happens if kids require hospitalization? I'm going to use this platform today that he spoke about exactly what was in my head, called Break the Chain. But I want to add Break the Chain in Kids too. I want to add that platform of Break the Chain in Kids too.
Absolutely, and I must add this anecdote about using a platform as powerful as this, and it's one of the reasons why I started Kidsstoppress. So I would go. My pediatrician is Dr. Balsekar, and I would go to him each time and go with a long list of questions. And he actually came up. He said,
Correct.
"I have so many questions. Why don't you just
Hmm.
convert it to a platform so I don't need to
Correct.
answer questions?"
Correct.
Exactly. I mean, he's really the brainchild behind this, and I keep thanking him for it because this really will help break a lot of myths. My next question to you is that kids contracting the virus as an India
Hmm.
phenomenon, or do you think it's a global phenomenon? I mean, have you seen or studies?
Correct. The thing is, there are two reasons for this to happen. There are two reasons. A, we did get lax. We did kind of let loose in the month of December, Jan, when things were better. The kids were too cooked up inside. Parents were fried. Cases are less, and we've not heard of anything in kids. Let's at least let the kids go down and play. At least, let's kind of little loosen out on the rules that we have masks on all times. The kids, nothing happens. Let them go down. So that's how it started. And that's how it started 3 months ago in the United Kingdom, 3 months ago in Brazil, in South Africa, sorry. So these things, kids started getting very infected. So they started getting the disease, they started turning positive. Two reasons. One, laxity. And second, which our government is still working on, and I think they will not admit to it, but I'm pretty sure the virus has mutated. So the new mutated virus has two different strains, and these strains are much more aggressive than what it was before. These strains are causing younger adults to get the infection. These strains are causing the infection spread to be quicker. These mutations are causing the severity of the disease becoming more. And lastly, these mutated strains are causing infection in kids. This was seen in UK, South Africa, Brazil, and now it's here, last 1 month. So laxity of parents, not to blame them, and query mutation of the viral strain.
Also, doctor, if you can walk us through the typical symptoms that you are seeing, and
correct.
When does one press the alarm bell and say, okay, this could be different?
I'm going to start the other way around.
Okay.
Do not ever press the alarm bell when it comes to kids. Let me reassure you, as of now, at no point, no matter how sick your child is, you do not need to press the panic button. That is a guarantee that I'm giving you as of now. Second, what symptoms to look at? Okay, let's start with making simple protocols that if your kid is above 1.5, if your child is above 1.5 to 2 years of age, and he or she gets fever, isolate. Period. Put the mask on, take it as COVID as of now.
Yeah.
Give fever medicines for 2 days. What you normally do. Confident parents, confident mothers, it's fever. Why not? I'm not asking you to change that. I'm only asking you to mask up. That's all. Very difficult to isolate children. Kids under 2 years cannot wear a mask. Above 2 years, request them. Try as much as possible. So your kid gets fever, mask up. Try and keep your grandparents or caretakers who are above 55 and 60 away from the kids. They can hold on to their affection for a few days. No hugging, no kissing, maybe separate room if possible, because they are the ones who stand to lose the maximum. So that stays away. Second, 1 day of fever, medication. Second day, talk to your pediatrician. He or she will tell you, you know what, give it another day. Let's see, there are no associated symptoms. The fever is kind of being under control with your medications. If the fever doesn't go in 48 hours, see your pediatrician. The pediatrician is going to assess clinically. You cannot assess because this is a multi-systemic disease. It affects every organ. It can present with anything. 60% of the kids present with fever. The other 40% can present with anything from head to toe. Rashes, red eyes, loss of smell, loss of taste, earache, difficulty in swallowing, swelling up of fingers, rashes on the body, stomachache, cramps, vomiting, nausea, loss of appetite, severe headache, severe body ache. It presents with anything and everything. So very difficult to kind of sit at home and try and figure out that this can be COVID. So it's very simple. Kid has fever, your child has fever, mask up, try and isolate, follow the norms, step up your hygiene protocols, step up your sanitation protocols, talk to your doctor. Doctor says, keep giving fever meds, 48 hours, go see your doctor. Now the doctor, the pediatrician, because of the last 1 month's experience, is going to be very confident in telling you on clinical examination itself, look, this looks like COVID. Okay. Let's be patient. We have our ways in which we examine the throat, looking at the overall demeanor of the child, the patterns of fever, the severities of fever, and query history of travel or exposure. But that's also become very funny now, because whichever parent I say that there is a possibility of COVID, the first reaction is, "Doc, we've not stepped out in 10 days. We've not stepped out in a month." And I don't blame them. The funny part is, and I just read an article right now before this interview, that isolation does not prevent or help in the second wave.
Wow.
Because now it's a pandemic. I wouldn't go as far as to call it airborne, but it's impossible to figure out the source and the contact tracing. What used to be in the first wave, now, second wave, it's just everywhere. So whether you've stepped out, whether you've not stepped out, it's there around.
You're not, this is hard, right? Because like I started with my introduction, that until it was with me as a parent, right, I was okay. Now when it comes to somebody that I love more than me, it's so much harder.
Right. It is hard. It is hard.
I must also ask you, because we've been asked this question repeatedly, and New York Times article on this. Breastfeeding moms who've been vaccinated, can they feed?
Yes, they can. They should get vaccinated and they can feed. It's called passive transmission of immunity. In fact, it's better for their child who's being fed, because you're giving antibodies to your child. The IgGs, the IgAs, they all go through the breast milk. So please take your shot and keep feeding. In fact, we go to the other level and say that even if the mother is positive and is not that badly symptomatic, wear a double mask and feed. Please feed.
Which was actually my next question, that as a mother, if I'm nursing my child and I am positive, is it okay to feed? And you're saying that's fine.
Yes. There are ways in which you decide. So this is what we do. I'm going to try and tell you a hypothetical situation. Let's start with the mother and father being positive, which was a more common phenomena in the first wave, and the second, the child being okay. So we used to say that whenever a parent is infected or both the parents are infected, decide before this, as of now, in case the mother or father gets infected, who's going to be the primary caretaker of the child? Who's going to take responsibility? Now, if the child is less than 2 years, obviously it's going to be the mother. We are not favorites of kids less than 2 years of age as dads. So the mother is going to take responsibility. She's going to wear masks and be around with the child, sanitation, hygiene. If the child is more than 3 years of age, the father can step up in case the mother's infected. If both are infected and the kid is above 3 years of age, ask the parent of the lesser symptom to take care of the parent, of the child. Whichever parent has the lesser symptoms can take care of the child.
Right.
So that's the protocol, but at no cost will the grandparents ever take responsibility of the child. Now tables have turned in the second wave. The kids are turning positive. So now what? No one's positive, the kid's positive. Right. Everyone's shaken up. How did the kid get positive?
Yeah.
Maybe went down, 10-year-old going down, hugging and kissing his friend, met after a long time, running around playing with masks down. Absolutely normal. I mean, that's what you want kids to play like. So now they're turning positive. Parents are wondering, now what? Again, even if the child is positive, one parent takes the responsibility. Like I said initially, the grandparents back out. One parent decide it's not a risk, but yes, it's comparatively risky. And I will wear masks and take care of the little one till he or she doesn't recover.
I know you said this. Wear a mask and take care of the child, but do you feel, kids, at least 10 years, you can possibly isolate them, but the 3-year-old, if the parents have any comorbidities, of course they don't have too much of it.
So the parent with lesser comorbidities, lesser at risk, should step up and do, because you cannot isolate the child. We don't recommend isolation of child. Hence there is a big question mark whether you should test the child, because what happens in a city, if the child comes positive, right? There are organizations, municipalities involved, rightly so, who have no clue what to do if the child is infected. They will put a sort of a paper outside saying that there's a case in this house, but they can't take the child to an isolation ward. They can't insist that the child gets isolated in a room because it's not possible. So the municipality, again, have not set rules. I don't even think they are aware. I see it flashing in the news, but I don't think they're aware that kids are falling sick as well. So it is protocols which the pediatrician has to convey. Again, entirely, we do encourage testing, but now because of no set protocols from municipality, we encourage not to test as of now. But take it as COVID and do what we just discussed if the kid has fever.
In case the grandparents are vaccinated, can they take responsibility of the child?
Let's start with this. First vaccine, 10% immunity, as good as nothing. Second vaccine, if taken after 4 weeks, 4 to 6 weeks, takes another 3 weeks to reach 75%, which is what Covishield and Covaxin claim. So if all those factors are matching, then they can. Again, if they were my grandparents and I had a child, we've seen real bad situations in elderly, so I would still not advocate if possible.
Right. No, I think that's absolutely valid because, at the end of the day, we're the parents, right? So I think, and we are at a far immunity and
lesser risk. Yes.
What about kids who've already tested positive? Are they at lesser risk this time?
All right. So I'll tell you one thing. It takes a significant disease in any adult, and by significant, I mean 5 to 7 days of fever, a little bit of suffering, maybe a little chest involvement, whether hospitalized or no is secondary. It takes that much of a disease to develop antibodies against the disease. So if you say that, okay, I tested my kid maybe 3 months ago, he had a 1-day fever, it came positive, but then he was okay. That is not a significant enough disease to develop immunity in your child. So I would, be strong, go out and say that, look, no protection so far.
Right. About isolation and anxiety related symptoms, right? Like, because up for a really, really long time. Have you seen any bit of anxiety or social behavioral issues in kids leading to, symptoms of which you feel could be conflicted or complex?
I've seen both the sides. We get the mothers with the kids. So first I have to listen to the mother of how frustrated she is for 15, 20 minutes. And then I have to listen about a child. Kids under 5 years old, actually, they bump around in the house, they spend time, they have their iPads, they have their TVs, they have their online thingies, and they're done with the day. Above 5 to 7 is when the constant negativity of COVID news, death rates, relatives being infected, don't do this, don't do that, the virus is spreading, I can't go to work, it percolates, kind of mulls, kind of grows. And there are a lot of inherent phobias we are seeing, inherent kind of paranoias in kids above 7 and 8 years who still don't want to step down, who won't touch me, who won't do this, who will sanitize, who are roaming around with sanitizers everywhere. So we are seeing that. Now, what we do is, this condition has been unprecedented. Nobody has ever planned or kind of figured that this could reach this particular point. So whenever it hit us, we were also hit hard. So we ourselves were scared. And that same paranoia and fears now, unfortunately, has been passed on to our children, mainly above 7 to 8 years of age. What you need to do is don't scare them. We've seen patients, we've seen kids come in and say, I'm having this, and they're turning into kind of hypochondriacs now, kind of relating every symptom they have or what their parents have spoken about, or this is also possible, that is also possible. So stop the fear. Don't talk about COVID all the time in front of your children. And structure their day so well that from the time they wake up till the time they sleep, they don't have time. They don't have time to think and talk. Yes, I'm saying you spend quality time, but structure their day well so that their mind doesn't have time to kind of cook and grow fears and phobias, and where their day starts and where their day ends, they don't realize. Easier said than done. But then from the experience of teenage children that we're having who are in tremendous amount of phobias, plus the insecurities of education and exams, no exams, and sitting at home doing classes, which is not the same, it's not helping. So just 2 pointers. Don't talk about COVID all the time. If you're scared, don't express it in front of your children too much so that it scares them, because they think about it and cook it for a longer period of time and then it explodes at a later date. And 3, have a well-planned, structured day for your child.
Kids less than 2 or 3, should the parents step out for vaccination, regular vaccination? Or they can postpone?
Do not hesitate to go to your pediatrician's office if the child is sick, or for regular vaccinations. Regular vaccinations are the key to preventing complexities of the disease. Even if he gets COVID, the COVID is not going to bother children, but the immunity drops, the other diseases, which are preventable diseases by the regular vaccines, will make it worse.
Okay.
Please follow the schedule as much as possible.
Right. Doctor, another very important question when you mentioned about teenage children, there is a huge black hole for parents whose kids are between 10 and 16 because the pediatrician
Correct.
kind of moved off them and the adult
Right.
kids less than 16. And I
Yeah.
think
Yeah. Yeah.
parents just don't know what to do. Like, who do they consult? So, any
No,
bit
go to your pediatrician.
good.
Your pediatrician will be more than happy to take your child under 16 and will keep constantly reminding you that till your daughter or son gets married, I will be there. So don't so don't worry.
Right.
As long as you are invited.
Right. And of course, my second last question, I won't ask last, but the second last question,
Sure.
supplementing foods, right?
Ah.
Of course, the regular diets and all of that is great. And we're all trying to do all of that. My question is, right supplementation, and are we over supplementing our kids?
Yes. So I'll tell you what. I mean, the commonest used terminology for this is how do I build my child's immunity?
Right.
Immunity is the most spoken about word right now.
Abuse.
And yes, yes. So let's start by saying primarily the best way to avoid the disease is don't step up. Let's break the chain. I'm going to reiterate it. I'm going to drain it into the parents' brains that please, for the next 7-10 days, no tennis, no football, no going down in the compound. Only two places. Either you go to your doctor or you take your car, if allowed, you take your child out for a drive once in a while, and that's pretty much it in an enclosed environment. For the next, please, I beg and plead, for the next 7-10 days, just hold on. Because kids, it's not a joke anymore. Kids are really getting it. As of now, they're recovering very well. And I keep mentioning as of now because I don't know what's going to happen a month down the road. So again, stay indoors for the next 7-10 days. Number two, a well-rounded diet. To build immunity, what the kid needs is the right amount of carbs, proteins, junk up, but there's healthy junk. So let them. No problem. Make your pav bhajis, make your pizzas, make your stuff, whatever you make. Switch to healthier options in the content so that it's a well-rounded diet. And number three, do your vitamins. There are only three main vitamins which are known to help and kind of, I wouldn't say prevent because there's nothing that prevents the virus from entering the body. But yes, your child, if it's well stocked up on these certain levels in the blood of vitamin C, D, and zinc, it can reduce the manifestations of the disease, it can reduce the symptomatology of the disease, the severity of the symptoms, and the length of the disease. All three can reduce vitamin D, vitamin C, and zinc.
Right.
So do your booster courses of vitamin D's because you need them. Anyway, kids are not getting sunlight, so they're all dropping. I can say around very confidently the 75 to 80%, if you test the levels, they're going to be less than 10, which is less than the normal required range for normal functioning of immunity system. So do your booster doses of sachets. Your pediatrician will tell you what are the dosage. Because don't overdose. There are situations and conditions called hypervitaminosis D, hypervitaminosis C, which can do more harm than good. Vitamin C, again, above 10 years is the regular adult dose of 1 gram per day. Between, I would say, 3 and 10 is 500 mgs, which are much higher than the normal RDAs, but they're known to prevent. When you do these, do it for a while and stop. Do it for a while. The COVID's been a year and more.
Right.
I know parents.
Are we over supplementing?
Yes. A lot of parents are.
Flushed out.
A lot of parents are. So what we do is tell them, okay, do 2 months, take a break for a month. Do 2 months, take a break for a month. If you know you've traveled, do it again. You want to build up the immunity. If you know that you've been kind of exposed or there's been people around, cases increasing, again stop. So keep it, but keep talking to your doctor because what happens is, people have started talking to neighbors and treating kids on their own. Even they've started azithromycin. It's become the new wonder drug. Start AZ. Nobody even knows what AZ is and when is it given. Don't become doctors. Don't use Google as the primary point of reference. Don't use your neighbors and friends' chats as your primary point. Start this. Right. Talk to your doctor. They're always there to help you.
Sure.
It's not urgent, so don't call them. They are overworked, but you can always leave a text. And they will reply back, hey, look, start this and take it for a month or two and let's go easy. But again, vitamin D, vitamin C, and zinc.
Doctor, last bit. I know we've spoken everything about the kids, but I know you're a parent as well. How are you addressing the anxious parent and how are you addressing your anxiety as a parent as well?
So My anxiety in the last 1.5 months has been coming home and meeting my kids, because when I see kids every day, even though we are all using protective gear, there's a little scare as a father's heart that, should I hug my children? Should I wait? Should I first go for a shower? Even if, what if something's left behind?
Yeah.
And then to have that guilt if something goes wrong is absolutely miserable. So that anxiety as a parent, but then again, knowing the fact that today the pediatrician for a child is your first point of contact, is more like a family member.
Absolutely.
With that, yeah, it's more with that immense responsibility. You can't back off at this stage. We can't shut clinics and just turn off our phones at night and say, look, you know what? Enough for the day. Not now. Not for the next few months. This is where we need to step up our game. We need to be there for our worried parents. We need to guide them through. I need to use platforms like yours and just tell them, look, calm down. We are there for you. Nothing's going to happen to your children. We are there. Speak to us. But don't come late in the day when you've already spoken to your cousin and relative and self-treated for 4 days. And that you can do for yourself, but not for your children. Please don't do that. Please don't do that. So my teenage kids are extremely supportive. My wife is extremely supportive. She is very proud at this moment that we are able to help in such a situation, and they are contributing indirectly. So I'm very proud of them as well. But it's very difficult when it comes to teenage kids at home to continuously. One of them has just entered college and there's no college, and she didn't have a 10th grade exam, and initially it sounded like a dream come true, and now she's just going crazy at home. So it's not easy. But this is the time when I tell every parent of a teenage or any child above 6 years of age, you can actually befriend them to a level. Forget being a parent right now. Sit down, talk to them, keep listening to them, because they will communicate. The minute they say something, you shut them down and say, look, no, all this, you can't do that. No, hear them out. I know you can't go out. I know your friends want to come over. We will plan. But weigh the risk, explain them. They're too smart. What we understood at the age of 15, they're understanding at the age of 9 and 10. Absolutely. They will understand everything. Please befriend your child. You have an additional member in the house to play with. Have a blast. Turn into a child yourself. Play games you never played before. Get your carom boards out. Get your monopolies out. And have a blast with your children. Trust me, they are amazing to be with. And you will suddenly feel that, you don't need your friends anymore.
Absolutely. And I completely reckon with you on that, because my kids have, I think, all through COVID helped in multiple ways. They've become my little team at Kidsstoppress.
Right.
So that's phenomenal. They've learned to shoot, edit, create lots of fun stuff, everything. And
they teach us.
Next time you need a hand on Instagram, you can just call any of us at Kidsstoppress.
I'm so new to this, but I'm just, flabbergasted by the impact of this media. It's very new, and every time my wife asks me that, why are you saying the same thing again and again? I'm like, no, every time there's going to be a new batch of mothers. Yeah. Some of them may be there. They may be hearing it. So there are two advantages. If they've heard me before, they're hearing it over and over again. It drills in. So it's called the impact of multiple kind of exposures. And the new parents. So if those parents spread the word. So I really want to break the chain in kids too. So I want to work on that. I want to help out. And thanks to people like you, I have this opportunity to make it happen.
Perfect. Thank you so much, doctor. And like I said, next video out, if you need a hand, we're there.
Sure. 100%.
Thank you so much.